Assalamu alaikum. Very important questions of your pharmacology and toxicology. See here, this is the D Pharmacy second year important subject that is pharmacology and toxicology. Here we will discuss some of the very important questions with answers. Okay, you will get the notes in the description. You can download the notes from the description, and before that downloading the descripted note, you understand these questions. Means here with explanation how you have to write the answers for the particular question in this video. I had completed that. So invest your just you give me 20 to 25 minutes for part 1. Definitely you will pass your examination, and no need to practice, no need to read once again in your home. Okay, just if you hear this what explanation I am doing, no, that's enough for your examination. Just you write that. Okay, yes sir, let's start with the, see, these are the question papers I am referring: 2018, 2019, 2020. Okay, mainly the government of Karnataka. Maybe from the examination will be this month, 25th of July maybe. Yes, let's discuss with the number 1 question: pharmacology and toxicology, important questions and answers. Discuss the different factors modifying drug metabolism. See, first you have to write what is this drug metabolism. Metabolism is nothing but a breakdown. Okay, is the metabolic breakdown of drugs by living organisms, usually through specialized enzymatic substance. See, enzymes play a vital role in our human body. Enzymes, these enzymes, what they will do, the complex substance they will break down in a simple form, so that simple form can be easily absorbed. Simple one. Now let's discuss the factors affecting. See, genetic factors results in difference in the expression metabolizing enzymes and genetic polymorphism. Okay, means difference gene expression metabolizing, just some of the metabolizing enzymes are present, then genetic polymorphism, these will affect the drug metabolism. Okay, then physiologic factors here including age, hormonal changes, sex difference, pregnancy and nutritional states. If changes in these ages, if having for an example, see, 20-year aged person when compared with the 65 years aged person, there is a lot of difference. In the 20 years aged person, what happens? Enzymatic reaction, drug absorption, drug quality will be more there. But in the 65-year person, what happens? The drug absorption capacity of the drug metabolism is decreased. Then here pharmacodynamic factors including dose, frequency, route of administration and protein binding. See, dose also very important here. Then frequency of that particular drug, then route of administration, either you are giving oral or IV route or rectal route, these are also very important. Then environmental factors, this depends on the competition with other drugs for the metabolizing enzymes, but toxic chemicals such as carbon monoxide and pesticides. Means environmental chemicals like monoxide and pesticides. Okay, yes, so these are the factors affecting the modifying drug metabolism, different factors. Now let's discuss with the question number 2 with answer. Define prodrugs, cumulation, hypnotics, statistics, pharmacology, pharmacokinetics, pharmacodynamics, then biotransformation. Let's study one by one definition of these very important definitions. These are definitely, they will ask you 4 marks in your examination. Okay, prodrug. See, it is the biological inactive compound which can be metabolized in the body to produce a drug. Prodrugs means means these are the initial drugs. They are not in active form. Basically, these drugs are in inactive compound and they metabolize in the body. They start the breakdown process in the body to produce a drug. Means inactive form get converted to the active form. Okay, by the metabolization. It is the prodrugs. Then cumulation, the process by which blood levels of a drug build up, thereby increasing its therapeutic and toxic effect. Cumulation means here what happens, here building up the therapeutic effect or increase in the therapeutic effect. It is known as cumulation. If the drug dosage exceeds the elimination rate, the drug will cumulate. Means if the drug dosage exceeds, means what happens, the elimination rate gets increases, then the drug will cumulate, build up. Cumulate is nothing but building up the concentration of the drug. Then hypnotics, these are the medications used to induce, extend or improve the quality of the sleep and to reduce wakefulness during sleep. Very simple. See here, hypnotics is nothing but the sleep inducing drugs, just we are giving to increase the sleep of that particular patient. Now in the middle of the night some patient they will get wake up in the middle, so to prevent that wakefulness, what we are giving, we are giving the hypnotics. Next question on pharmacology. What is this pharmacology? Very simple. It is a branch of medicine concerned with the uses, effects and modes of action of the drug. Very important this one. Uses of the particular drug, effects of that particular drugs and mechanism of action. Okay, then pharmacokinetics, it is a branch of pharmacology with deals with the movement of drugs within the body. Movement of drugs, very simple. See, you are taking a drug via mouth. Okay, don't go for this diagram. Diagram is not good. Don't go through the diagram. See, this is the mouth, we are taking through the oral route. Now the movement of the drugs from mouth to trachea, trachea to stomach, then stomach to the small intestine, small intestine to the large intestine, small intestine to the microvilli, microvilli to the blood. Okay, then blood, it goes to the site of injured site, means where it has to be acted. Okay, this is the is known as pharmacokinetics of the drug. Then pharmacodynamics, it is the study of a drug molecular, biochemical and physiologic effects. Effect of that means drug molecular, what's the molecular of the drug, then what's the biochemical reactions of that, and effects of the means actional effect or physiologic effects. Okay, the last one is biotransformation. See, it is the metabolic process that takes place mainly in the liver and helps to facilitate the excretion of both exocrine and endocrine substances. Mainly this biotransformation metabolic process, and it takes place mainly where, in the liver, and it helps to facilitate the excretion by both exogenous and endogenous substances. A series of reactions alter the chemical structure of these substances. All these processes takes place where, inside the body only. Next, let's move towards the question number 3 of your very important session, part 1 of pharmacology and toxicology. Explain the stages of anesthesia. See, one more point to remember here. This pharmacology is related with the pharmaceutical chemistry. Pharmaceutical chemistry, what we have discussed now. First subject, pharmaceutical chemistry 2, we discussed. See, anesthesia, local anesthesia, then general anesthesia. These all questions are repeated here also. Okay, what questions you have practiced? No, I have practiced for you where in the pharmaceutical chemistry 2. No, thus maximum 5% questions are asked in this pharmacology and toxicology. So better you give preference there also and here also. So some questions which were repeated, I have not wrote here. Repeated means those who are repeated in which one? In the physical, in the pharmaceutical chemistry 2. Okay, we discussed in the earlier class. No, there that questions I have not covered here. Some questions like 2 to 3 questions I have skipped there, like local anesthesia, general anesthesia. Okay, those all I have already repeated, so just you can go through that. Anesthesia, it is a temporary state that causes unconsciousness, loss of memory, lack of pain and muscle relaxation. Simple. Anesthesia means what here it is a temporary relaxation. A patient goes to coma temporarily. Then stage 1, see some of the stages are there: induction stage, excitement stage, then surgical anesthesia. Stage 1, that is induction, the earliest stage lasts from when you first take the medication until you go to sleep. Okay, first stage of this is this one. Which one? Induction. Here what happens, just you have to take this anesthetics before going to bed. This is the first point. Then you are calm but able to talk for a while. Here just you are calm means the drug action just now it starts. Okay, here loses the ability of pain. What happens? It loses the ability of pain. And then second one is excitement. The second stage can be dangerous, so the anesthesiologist will want to get you through it it as quickly as possible. Means from this second stage, that is excitement, the doctors, those are known as anesthesiologists, they want to bring you from this condition, second stage, out as soon as possible. Why? Means you could have uncontrolled movements, fast heartbeat and irregular breathing here. Okay, then stage 3, last one, surgical anesthesia. See, at this stage surgery can take place. Last stage, your eyes stop moving, your muscles completely relax, the anesthesiologist will keep you at this stage until the procedure is over, until the operation, until the surgery is completed. Means at last he will keep you in this stage, last stage, that is surgical anesthesia. Okay, now we move towards the next question. See, before going to next question, you observe this one more stage, fourth stage, that is of the overdose. See, if you get too much anesthesia, your brain will stop telling your heart and legs to work. It's rare with modern technology. Means, see, if overdose of the anesthesia, if the doctor has given you overdose, means then what happens? Your brain will direct to the heart and the lungs to stop their work. So what happens there? Chances of death. But in today's modern generation, it is very rare case. Right? The pharmacology of glucocorticoids. See, mainly glucocorticoids, these are the steroid hormones released from the adrenal cortex. See, uses of the glucocorticoids, they are used to treat the inflammation, asthma, COPD, then rheumatoid arthritis and osteoarthritis. Effects of these glucocorticoids effects such as skin thinning, acne, atrophy, impaired wound healing. Okay, they will affect here, glucocorticoids. Then they increase the risk for gastrointestinal tracts. Means acne pimples, then atrophy, swelling, then impaired wound healing. These all are due to the glucocorticoids. Then action of glucocorticoids inhibit. Action is nothing but pharmacology or mechanism of action. Glucocorticoids inhibit many inflammation associated molecules such as cytokine, chemokines, adenosine molecules. What they will do? They will inhibit these molecules and it contracts anti-inflammatory mediators often are upregulated by glucocorticoids. Just what they will do? They inhibit the inflammatory cells. Suddenly, if the inhibition of the inflammatory cells increase, means what happens? Your inflammation get reduced. Then what are atherosclerosis? Classify the drug. Very simple. Atherosclerosis, buildup of fats, cholesterol and other substances in and on the arterial wall. The buildup of cholesterol plague in the walls of the arteries causing obstruction of the blood flow. See, drugs used for the atherosclerosis, statins like levostatin or lovastatin, atorvastatin, fluvastatin, then fibrates like fenofibrate, fenofibric acid, okay, gemfibrozil, niacin drug, immediate release, extended release, then bile acid sequestrates like cholestyramine, okay, then cholestyramine, okay, cholecalciferol. These all are the drugs which were used to give for the patient atherosclerosis. If you are unable to pronounce these difficult words, means just to remember niacin, fibrates and statins. Here atorvastatin, okay, then levostatin, fluvastatin, statin. See, these are the statins basically. You remember by this way. What is myasthenia gravis? Give its treatment. Very simple. Myasthenia gravis is a weakness and rapid fatigue of the muscle under voluntary control. This condition is caused due to breakdown in communication between nerves and the muscles. Here what happens? Communication between the nerves and the muscles has been stopped. Breakdown, the relationship has been cut here. Okay. For that reason, myasthenia gravis is caused, main cause. Symptoms like muscle weakness or weakness of the arms and legs, then dropping of upper eyelid, difficulty in speaking. These all are some symptoms. Treatment, there is no actual cure for myasthenia gravis, but treatment can prevent here. Oxygen through a face mask we are giving, using steroids, then intravenous immunoglobulin therapy, prednisolone, then azathioprine, long acting anti-cholesterase like pyridostigmine bromide, neostigmine bromide, okay, pyridostigmine bromide, neostigmine bromide. These are the some long acting anti-cholinesterase. Okay, by giving this we can just prevent this myasthenia gravis for a short duration. Next, water expectorants, then and bronchodilators. Give example. Very simple. Expectorant, these are the oral drugs that are increase bronchial secretion or reduce its viscosity, facilitating its removal by coughing. Simply but they enhance the clearance of mucus. Simple. You remember this one. What these expectorants do? Just they will remove the mucus from the lungs. This one. Okay, and they will treat you from the cough. Then they are also called mucokinetics. Kinetics means movement. They help to movement of the mucus from lungs to the outside. Then example, say guiafenic, Example, guaifenesin, then potassium iodide, ambroxyl, bromohexane, ammonium chloride. Guaifenesin, potassium iodide, ambroxyl, bromohexane, ammonium chloride, these all are the examples. Then bronchodilators, these are also a type of medication that make breathing easier by relaxing the muscles in the lungs and widening the airways. What they will do, see, these are the lungs. Simple diagram. What happens, see, these are the lungs. Now what they are doing, which one, these bronchodilators, just they will relax the muscles here, where of your windpipe and of your lungs. By relaxation, what happens, the mucus or the any like the macrophages shows their action. In simple, by taking these bronchodilators, your lungs get relaxes, windpipe get relaxes, and you are free from cough. Means easily the mucus can be expelled out. Simple. Okay, and they are often used to treat long-term conditions where the airways become narrow and inflamed, such as asthma. Beta-2 antagonists like salbutamol, salmeterol, and formoterol, formonide we are giving, no. Then anticholinergics like ipratropium, then tiotropium, aclidinium, theophylline, what we are calling, no, salbutamol, ethopylline, theophylline, acetylene 2 mg, acetylene 4 mg. These all are used as a bronchodilators. Yes, now let's move towards the question number 8. Question number 8, what is here? Give the physiological role of histamine. See, histamine, a chemical found in some of the body's cells, causes many of the symptoms of allergies such as running nose or sneezing. This is the function of the histamine. It is the chemical compound. Then what is the physiological role of histamine? Allergic inflammation, alternation of vascular, let's study this one, alternation of vascular permeability, extravasation edema, inflamed. Then adson molecules, means inflammatory molecules deposition, inflammatory cells get migrated. Okay, then gastric acid secretion, regulation of gastric acid secretion, immune cell differentiation. Okay, then neurotransmission, regulation of neural histamine turnover, then immunodulation, immune cells, chemotaxins, immune response, inflammation. What are these? These all are the physiological role of histamine, how the histamine works actually. Okay, for allergic inflammation, how it works, then in gastric acid secretion, what's the role, how it works, neurotransmission, how it works, immunodilation, how it works. These all are the role of the histamine. Yeah, now let's move towards the 9th question. What are hematonics? Explain them with example. Hematonics, these are the substances that are essential to the proper formation of the components of blood. Basically, if the patient is suffering from anemia or anemic patient, okay, the red blood cell is below 9, below 7.8, below 8, okay, then what happens, we are giving this type of the external like hematonics. Hematonic is a nutrient required for the formation of the blood cells in the process of hemopoiesis or erythropoiesis. The main hematonics are iron, vitamins, and folate, okay, folic acid. Examples of hematonics: iron, oral use we are giving ferrous sulfate 200 mg tablet contains 20 to 32% of iron. Ferrous gluconate 300 mg tablet contains 12% elemental iron. Then dexorange hematonic capsule composition. See one example, dexorange syrup, dexorange capsule. It contains ferric ammonium citrate, Indian pharmaceuticals 160 mg, vitamin B12 IP 7.5 mg, folic acid IP 0.5 mg, zinc sulfate monohydrate IP 20.61 mg, excipients quality sufficient. Okay, see, these all are the composition of the dexorange capsule. Okay, just you can go to the medical shop and you can ask this dexorange hematonic capsule, just turn the backside of that and see all the composition are present. Next, 10th question, what is significance of protein binding? See, absorption, systemic solubility of the drugs, distribution, elimination, diagnosis, therapy, and drug targeting. These all are the importance of the protein binding. Now, what's the role of this protein binding in the drug? Absorption, mainly metabolism. See, absorption, the binding of absorbed drug to plasma protein decrease the free drug concentration. Thus, I will explain you later, don't worry. Thus, a sink condition and concentration gradient are established, which now act as a driver sink for further absorption. Very simple. This drug and protein complex, what they will do? They will increase the absorption. You remember this one. Drug and protein complex, what they will do? They will increase the absorption. How? By decreasing free drug concentration. Then systemic solubility of drugs, some of the water insoluble drugs, neutral endogenous macromolecules like heparin, steroids, and oil soluble vitamin are circulated and distributed to tissues by binding especially to lipoprotein. See, water insoluble drugs many are there, and lipid insoluble drugs are there. Due to the protein binding, what happens, they will form lipoprotein, lipid and protein insoluble. Lipid is insoluble drug, okay. Lipoprotein, they will form this complex lipo and protein, and they make the drug to soluble, okay. Then distribution, the plasma protein drug binding thus favors uniform distribution of drug throughout the body by its buffer action. Plasma protein, see, this plasma protein drug binding, both the drug, this one is a drug and this one is the plasma protein. Binding of these both drug and plasma protein, what they will do, they will influence, they will increase the absorption capacity, or sorry, distribution capacity of the drug, distributing everywhere. Increase in distribution, increase in the pharmacological action of the drug, increase in the high rate of the action. See, main distribution is main, absorption is main, systemic solubility of the drug is also a very important factor here. These all are the significance of protein binding, very important one. Next, let's move towards the discuss the functions of the prostaglandins. See, this one is the last question. The part 2 will be continued soon. I will upload the part 2. Prostaglandins, see, these are the group of compounds having hormones like effects in animals. Basically, these are the compounds, these are, we can call them as hormones. See, prostaglandins have been found in most of the humans and animals. These are cyclic fatty acids. Let's discuss about the functions. Level of prostaglandins affect the level of blood pressure. Due to structural differences present in a prostaglandin affects the different biological activities of the body. Many different biological activities can be affected by this which one, prostaglandins. Then prostaglandin work in autocrine and paracrine fashion. Now just I will explain you what is this autocrine and paracrine. See, now for an example, this is the hormone. What is this? This is the hormone. Understand the concept. Hormone. Now you know that hormone contains its own glandular cells, okay, or just simple cells, glandular cells. Now in autocrine, what happens, these glandular cells will secrete on its own cells, okay, that is known as autocrine. Now paracrine means, now see, this one is hormone, these are the glandular cells, and here some glandular cells are present. Now what happens, the glandular cells which are present here, no, that will secrete the hormones on the other cells. This is known as the paracrine, okay. Autocrine, paracrine, they work in, means these prostaglandins helps in autocrine and paracrine fashion, okay. Then they also mediates functions like inflammatory and anti-inflammatory processes. They also helps in contraction and relaxation of smooth muscle, and also these prostaglandins helps in the menstruation and in birth of baby, play a vital role. They also helps to release adrenergic neurotransmitters from the nerve endings. In plants, they produce jasmonic acid, which helps in plant reproduction, fruit ripening, and flowering. See, jasmonic acid, this is a product produced from the plant. This jasmonic acid influenced by which one? Jasmonic acid is influenced by, yeah, prostaglandins, okay. That is help for the reproduction, ripening of the fruit, flower production. See, these all are the 11 very important questions. Soon, inshallah rahman, I will upload the part 2, that too with the notes and explanation. If you are having any doubts, means you can ask me in the description. Thank you. Assalamu alaikum.